Hello, good afternoon. My name is Mana Sarai Benoit Ibarra, and this day we will talk about the neurolinguistic. The neurolinguistic is one that studies the machines and the human brain that efficiently can relate on understanding and acquisition of language, and whether and spoke better or the wind sings, establishing from their experience or their own the programming do it is a disciplinary nature. Okay, and the other topic is the loss of language. After a brain injury, the person way at the communication and their ability to understand and express themselves through the language can be altered. The other part of language and distorted, and although of the best kind known is aphasia. And aphasia in the affected spoke of language, and at the production and understanding and the ability to read and write. Okay, what is the aphasia? And the aphasia is the partial complete loss of the ability to express the understanding of the spoke, breathe, and language. It is due to injury to areas of the brain and the control of language. And the causes of aphasia is usually the result of disorders that not cause progressive damage, such as the following: and of stroke and heart injury and infection of the brain, encephalitis. Is such as the cause of aphasia does not continue to get worse, however, of the time. And however, is the result of the progressive disorder so the tumor to continue to grow and aphasia progressive, wherein at the tumor growth it found to express the area of the brain and the control of the language function of frontal impairs the ability to express or understand the language, and sometimes the dementia can also cause an aphasia that gets progressive in worse. The global aphasia. People with aphasia have the difficulty to express themselves and only studying the language, but the nature or degree of the difficulty of a variety reflecting the complex nature of language function. And the trio aphasia, when someone has the ability to read or understanding what is the biggest saying, but cannot produce words, and we are dealing with a CBP. Aphasia is the case of people with a brain injury sign, a very short sentence of 3 or 4 words, have to work hard to able to say in a shopping way. And the other is a mixed aphasia. The cases have the shopping and the costing speech like CBP. Aphasia but also have the difficulty understanding when they are read or when the others are saying to them. And the training, I use it as speech therapy and the communication service. And the conclusion, knowing about the language and the brain is very, very important since each fulfills the functions in the brain integrate the information received and the organized response, and control the motor and emotional function and inherit a cognitive function. A resulting emotional expression, memory, and language we use is to communicate the brain. Rural or language is up to all I use relationship and with people around. I use it also to exchange information. Another function of language is that also to express and feel. Okay, this is my presentation and thank you for your attention.